Tonight on Greater Boston, could it be deja vu all over again? The end of summer is once again bringing with it big questions about what lies ahead with COVID. This time around, we have a new tool to fight it. But will it be enough? And will enough people even use it? Then later, with Steve Bannon charged yet again for his scheme surrounding Trump, no pardon this time. A look back at my conversation with the New York Times authors of This Will Not Pass: Trump, Biden, and the battle for America's future. School is back in session. The weather's turning colder, and that means, as it has for the last 3 years, experts are anticipating at least some level of a COVID surge. But with a new booster, could this fall be different? Or will COVID fatigue and the CDC's latest move to relax restrictions lead to more bad news? We'll discuss that. Surprising, at least to me, new research on long COVID and new rules around COVID in our state's schools with Dr. Sabrina Assoumou, assistant professor of medicine at Boston University School of Medicine and an infectious diseases attending physician at Boston Medical Center, and Julia Raifman, assistant professor in health law, policy, and management, also at BU. She also leads the COVID-19 U.S. State Policy Database. Welcome to you both. Good to have you here.
Thank you. Thank you.
Julia Raifman, starting with you, as we head into colder weather, what is the level of seriousness and what's projected in Massachusetts, in our region?
You know, I think that we've had a really nice summer where we've had lower transmission. We've been able to gather more safely outdoors. And now we do see that people are gathering in crowded indoor settings without mitigation. And so we can expect the levels to increase. We also see that leadership on policies really makes a difference. When we do see those increases, we start to see a surge in COVID. If we implement mask mandates during those periods, it can reduce transmission, reduce the number of people who get COVID, the number of people who are hospitalized, who miss work because of COVID, the number of people who die.
Hold your breath on mask mandates, I would say, Julia Raifman, considering where public officials are. But maybe, what's your assessment of where we are, doctor, as we head into the fall?
You know, I think that if we take the long view over the past 2 years, we've learned a lot. We're in a different place. We have vaccines. We know a lot about the impact of indoor masking. We have testing and we have outpatient treatment. However, what we do know is that in the Northeast, especially in Massachusetts, the fall and winter is a time when we spend more time indoors, and cases are going to go up.
So the new boosters are available. I'd like you to say, starting with a personal tale, I register at the local Walgreens near where I live in Inman Square in Cambridge, and not one single appointment was taken, not one this coming weekend. So, doctor, starting with you, is there any reason anybody 12 or over should not be getting the booster, assuming that they didn't get another booster at least sometime in the last couple of months?
You know, this is very important. You know, we see people are getting tired of more vaccines, and we're all wondering, you know, what is the end game here? But the important point to note is that although the vaccines have been helpful, what we do see in the science is that there is something called waning immunity. And so the protection is going lower. And we also have variants that are more what we call immune evasive. And so they can overcome the protection from our vaccine. So it is really important for all of us who are eligible to get this new bivalent vaccine, because this is how we increase the protection in the community.
You know, Julia Raifman, I looked at numbers. I'm sure you know these much better than I. But for people who've had at least one booster shot, it's under 50% nationally. It's higher in Massachusetts, close to 60%. The numbers for teenagers are absolutely abysmally low. There's no reason other than crossing one's fingers to believe there's going to be a better reception for this booster than the ones that came before, is there?
You know, I think that what we do makes a difference. And so this is really a time for leaders, public officials to step up and to communicate to the public, to communicate to communities where there are lower vaccination and boosting rates, the importance of getting vaccinated now. This is especially important because we don't have those other layers of mitigation. So we're really going to be relying heavily on those vaccines and boosters. We see the boosters make a difference, and I certainly will be going to get the new vaccine, the new booster, as soon as possible.
But Julia, staying with you, if someone said to you who was, you know, not an anti-vax nut, but somebody who was just anxious, nervous, and said, well, I read that there weren't even clinical trials with humans. They only tested this new Omicron variant responsive vaccine on mice. That's not good enough for me. What's the response to that?
You know, I think it's important to look to the safety data and to see that we've seen COVID vaccines have been very safe, and COVID is not safe. So if you want to be nervous about COVID, be nervous about getting long COVID, be nervous about being hospitalized or having someone in your household who is. What we see of the vaccines is that they are safe and that they help prevent those severe effects of COVID. It's too late to get vaccinated once you start to develop those COVID symptoms, and you really want to have that protection before that happens, especially as we see community transmission will likely increase in the coming week.
Dr. Assoumou, a lot of doctors, from what I read at least, in an attempt to make this more normal for people to get the COVID vaccine, are suggesting that people getting it to accompany their annual flu shot. Do you subscribe to that kind of doctorly advice?
Absolutely. Please get your COVID shot at the same time as you're getting your flu shot, because the other thing we're really worried about is that we're going to have a pretty bad flu season. If we're looking at what we're seeing in the Southern Hemisphere, it is probably going to be a very difficult winter. So getting vaccinated is going to be very important against the flu. Can I just add one thing? Because the headlines in the media have talked about these bivalent vaccines, and I think it's so key and important to correct some of the information that's being disseminated. So number one, I'm underscoring what Dr. Raifman said, is that, the mRNAs are not new. We have millions of people who've been vaccinated in the country and overseas also. The key thing is that the bivalent vaccines were tested in humans. It was a BA.1 bivalent, but it was tested in humans in clinical trials. What we do not have at this moment is the BA.5, BA.4 combined with the ancestral strain, the one that we'll be using. But the bivalent approach has been used in humans. So it's key to sort of make that distinction that people are not getting something that's completely new and that hasn't been tried.
I want to stay with you, doctor, though, for a second. The one thing I'm concerned about, because initially I love the idea of saying, since most people get a flu shot, just do it when you get your flu shot. The flip side, and please disabuse me of this concern, doctor, if you think it deserves to be disabused, the flu is serious. It's nowhere near as serious as COVID is. I look at the numbers in the New York Times every day. They're abysmal. 450 people a day. That's 150,000 people are going to die this year in this country from COVID. Maybe 20,000 will die, 1/7 as many from the flu. Are you worried that pairing of vaccines is going to subliminally convince people that COVID is sort of like the common cold kind of thing and not as dangerous as it continues to be?
It's interesting that you're mentioning that, because for me, I would say I agree with you that COVID is not the flu and it's more serious than the flu where we sit right now, if we look at how many people are dying of COVID. But, I'm an infectious disease physician, and I've been taking care of patients with flu every year, and the flu is no joke. Many people die of the flu every year. So it's definitely something that we take very seriously. But I think that what we're doing by recommending those two vaccines at the same time, we're using an opportunity. Instead of having you come today for your flu shot and come back tomorrow, we just want you to get vaccinated so that we can get as many people as possible protected.
Julia Raifman, let's move to schools for a second. I assume everybody watching, at least if they have a kid, knows statewide at least, no more mask mandates, no more testing requirements. I went to your Twitter page and you have something called equity policy principles for schools. What's that mean? What are you prescribing for schools anywhere, I guess, but particularly here?
Yeah, I think we're really trying to support schools and teachers and school communities. We see that schools are really essential for our society, that we want them to be safe places where people can be healthy and learn in an environment that's conducive to learning. And being able to stay in school with as little disruption as possible. We also want educators and staff who work in schools to be able to be there safely. And so it's important that schools, that we do have policies that help to keep them safe. Unfortunately, they are crowded indoor settings where COVID spreads quickly. So we want to make sure that everyone who is in a school setting is vaccinated and boosted before a surge happens. We also want to be prepared to bring in layers of mitigation if there are surges. So we do see that universal mask policies are far more effective than a handful of individuals wearing masks.
So is the state prescription too lax in your estimation?
You know, I think we would like to see much stronger leadership on surge preparedness and having a policy plan. And certainly we understand, it's been a long period. It's very polarized. But I think that we have swung a little too far. At first we had really extreme mitigation measures while we learned more about the virus. And then now we've swung to this period where we have no mitigation. And what we should really be doing is coming back to the middle and saying, let's use what we learned in a smart way and to really step up those layers of mitigation in surges. Now, unfortunately, we need to be ready to do that quickly based on what we're seeing in other settings where we have seen the start of school actually lead to those surges. So can we step up routine testing? Can we step up vaccine and booster delivery? Can we step up and implement universal mask policies, even just for a limited period of a few weeks when we do see surges?
We only have a couple minutes left, but I want to touch on one topic. I mentioned at the top some new research that at least I found surprising in the journal JAMA, Journal of the American Medical Association Psychiatry, this research that's saying psychological distress before COVID increases the risk of getting long COVID more than physical things like obesity or asthma or hypertension or that sort of thing. Julia Raifman, that's powerful information. What do you do with that in a society that is under-resourced in terms of helping people with mental health to begin with, quickly if you can?
I think that we have to lead on taking care of one another, supporting one another through this in all senses. And so that is true with avoiding long COVID as well. Long COVID is a serious consequence. We have a lot more to learn about long COVID. But if we lead with coming together to protect one another, with making small sacrifices, to wear masks for a few weeks so that we don't have anybody left with long COVID or left without a relative in a few weeks, then we can get through this together.
I only have a minute left, Doctor, but I read you say that you were concerned that the same structural racism that made blacks more likely to get COVID to begin with are the same ones that'll create barriers to people getting adequate care for long COVID. Are people focused on that, or is that just another statistic that won't mean enough to people in power?
You know what? I think that's up to the people. Oh, sorry. Go ahead.
Quickly. Let me go Dr. Assoumou if I can. I'm sorry.
Now, I was going to say, I really hope that we start paying attention to long COVID, because as what we're discovering is that for a very long time, we are going to be dealing with the long-term consequences of acute COVID. So what I would like to see is for us, number one, to get data and understand who's being impacted, and also make sure that everyone has access to healthcare.
We don't know precise, we should make clear, we don't know precise numbers on long COVID. We just know they're a hell of a lot higher than originally projected. Julia Raifman, you have the last word on this long COVID thing, quickly if you can.
Yeah, I think we do need surveillance data on long COVID. We need to start gathering data on how many children in our schools are affected by it, how many teachers are affected by it, how many essential workers are affected by it, and to think about what we can do to support people who are affected by long COVID structurally. The best thing we can do, though, is prevent it. So, the best structural measures that we can take are to reduce transmission. And for that, we need leadership on these hard policy decisions that are aligned with evidence, equity, and inclusion. So we really hope to support our policymakers. We know it's hard, but we also know we can get through this together. So we hope that the equity policy plan we've put out will be helpful for policymakers. We are really grateful. 100 MDs and PhDs have endorsed the plan, and over 150 experts. So we hope that can be a resource as we go through the coming year.
From your lips to their ears, Julia Raifman, Sabrina Assoumou, thank you both so much for your time and your thoughts.
Thank you for having us.
Next up, former Trump advisor Steve Bannon surrendered to authorities today in New York, where he faces multiple charges for the We Build the Wall scam. That's the one where he and others convinced people to donate millions of dollars to fund the infamous border wall, and then allegedly spent much of the money for their own personal purposes. It's the same thing he was arrested and charged for by federal agents just 2 years ago before Trump pardoned him. Bannon is also still awaiting sentencing for his conviction on federal contempt of Congress charges back in July. Just some of the latest chapters in the fallout from Trump and his supporters' assault on U.S. democracy. An assault about which we seem to learn new things every day. That's thanks, at least in large part, to reporters like New York Times national correspondents Jonathan Martin and Alexander Burns. In their book, This Will Not Pass, Trump, Biden, and the Battle for America's Future, we learned, among other things, of would-be Speaker Kevin McCarthy saying he would urge President Trump to resign after the insurrection, and learned more about the political calculations of Mitch McConnell, who reportedly called Trump a despicable human being behind closed doors, but still refused to convict him twice. The authors joined me shortly after the book came out. Alex, Jonathan, congratulations, and thank you both for ruining my weekend. I appreciate it.
A weekend well spent. A weekend well spent.
Exactly. Well, let me tell you.
Beach read.
You know, the subtitle of your book, as I read, Alex, is Trump, Biden, and the Battle for America's Future. I think you could have added, if there is one. When you two were reporting and writing this book, was that not part of what you were thinking every night at the end of your work, Alex?
Well, I think, Jim, I think one way to look at that subtitle is the battle for America to have a future, right? The battle to secure the future of the country. There are multiple visions of what America ought to look like that we record in this book. And one is the Donald Trump sort of quasi-strongman view of government, and another is the more nostalgic and conventional Joe Biden view. And I think what we show here is that both of those approaches, obviously in very, very different ways, have really fallen short of the political moment. And the battle to define what comes next in so many ways is only just starting.
You know, Jonathan, we see McCarthy, we knew, humiliating himself, going down to that Mar-a-Lago bended knee thing, doubly humiliating himself when you report that he was said to colleagues he was going to urge the president to resign. No, I never said that. You released the audio recording. Obviously, humiliation again. Lindsey Graham, while you're interviewing Trump, calls in. Trump puts him on speaker without even telling him. And there's so many more. Why do so many Republican leaders tolerate being humiliated at the hand or foot of Donald Trump and still pledge fealty to the leader?
Well, it's a great question. I think it's two important issues. One is relevance. I think Kevin McCarthy and Lindsey Graham both want to be in the room, as they say. And I think sucking up to Trump and even humiliating themselves is part of the bargain when it comes to Trump. As you mentioned in the book, we have this extraordinary scene where Lindsey Graham is sort of put on speakerphone by Donald Trump and told to perform and basically tell us, the two people there to interview Trump, not just how important of a politician Donald Trump is and how great his endorsement is, but also just how damn good of a golfer Donald Trump is. I think Trump likes to sort of do that to people, to sort of prove to people that they are his supplicants, and to do so in the most excruciating fashion. I think the other reason is just straightforward politics. Republican lawmakers believe that their voters are still, obviously besotted by Donald Trump, and therefore the politicians themselves also have to pledge fealty to Donald Trump. Look, I think tomorrow, if Kevin McCarthy believed that the rank and file GOP voter out there in America had enough of Donald Trump, Kevin McCarthy would gladly move on from Donald Trump. This is an example of the leaders following the voters when it comes to Trump and the GOP.
You know, Alex, speaking of the leaders, can a GOP leadership that, at least in private, has utter contempt for Trump, and a GOP electorate that seems to still love him, how long can that coexistence stand?
Well, we're about 7 years and counting now, right? Look, I think one of the things that we do in this book is that a lot of folks, a lot of your viewers have probably heard and read for years that Republican leaders cannot stand Donald Trump. And the way they talk about him in private is nothing like the way they talk about him in private. And I think that people understandably have gotten tired of hearing that, and frankly skeptical of the reporting that suggests that, because surely people who genuinely had a problem with Donald Trump would not sort of kiss the ring and other things as they do again and again. But I think what we've shown in this book is that they really do talk about him quite differently in private. And I don't think it's sustainable forever, particularly if he runs for president again and sort of signals at the outset that he won't accept the outcome of the election unless it's a victory for him. I think we've seen in the primaries this month, including most significantly in Georgia, even Republican primary voters, there's a limit to how much they want to talk about Donald Trump's grievances about the past.
You know, Alex, staying with you for 1 second, other than the lunatics in the Republican Party, the Marjorie Taylor Greene faction, do any of the leaders of the Republican Party actually believe that the election was stolen, as they're willing to say publicly, to make Donald Trump happy?
I think the short answer is no. Look, I think there are people in the Republican Party who believe that there is more fraud than is demonstrated. I think there are people who sincerely believe that. I don't think we encountered one person in this book who we interviewed or obtained any reporting in this book to suggest that anyone at the absolute leadership tier of the Republican Party, other than Donald Trump himself, and as you mentioned, the real sort of inner ultra committed palace guard, truly believes that there's any doubt that Joe Biden is the legitimate president of the United States.
You know, Jonathan, one of the things that's most terrifying to me, you guys touch on, I don't know if it's in your introduction or whatever it is, you mentioned a number of unelected leaders who have stood up to Milley, et cetera. I had a former Secretary of Defense, Esper, on the radio with me the other day, and it's the same sort of theme. It was individuals doing the right thing, we believe, again, to thwart the worst of Donald Trump, but there were no institutional guardrails in place that if they weren't there, and it appears that even on bipartisan things like the Electoral Reform Act, whatever, there's no interest in Congress in creating those institutional guardrails, so we continue to be dependent upon the good behavior and goodwill of unelected individuals. Is that the sorry state of affairs?
Or in the case of Mike Pence, elected individuals.
Yeah, that's true.
Look, I think January 6th could have been a lot worse. I mean, both physically, obviously, it could have been a lot worse. There could have been more people assaulted or killed. But I think January 6th politically could have been a lot worse if Mike Pence does bend to that pressure. And the fact that our precious democracy was basically in the hands of Mike Pence that day. And if it's not for Mike Pence's sort of good judgment in that hour, we're facing a constitutional crisis in the most important democracy on earth. Tells you a lot about the reliance on individuals and just how corroded our institutions have become. And this is the sort of big question going forward and why this book is important. This is not about history. This is today and tomorrow as much as it is about yesterday. This is a current story. There's a reason why we called the book This Will Not Pass. We're still living through this stress test to our democracy, and we're going to see how it plays out potentially as soon as 2024.
Alex, you guys are pretty even-handed in this book. I mean, you don't spare the Democratic Party either. No accusations of the level of corruption either. But Joe Biden unwilling to settle the differences which arguably a president would have in terms of the progressive wing and the more mainstream wing of his party, the attempt to be both a healer and a transformational president, which may be sort of oxymoronic kind of thing. How would you describe how the Democratic Party is portrayed in your book, Alex?
Look, I think you did a pretty good job right there, Jim. I think that we saw the Democratic Party ride to power in 2020 with this broad and in many ways unwieldy coalition that goes all the way from Bernie Sanders and AOC on the far left to former Bush administration officials in the political center. And the only thing that really united them was the sense that Donald Trump was a dangerous president who couldn't be allowed to keep power. And I think what we show in the book is that Joe Biden and his party never fused that anti-Trump coalition into something more coherent and durable that allows them to operate the government in a reliable way. I don't think that we spare either side in this book. I also think that we're very, very clear that the two sides are not equivalent in their defects, and the depth and the nature of their defects. But the reality is, if you believe the Republican Party is fundamentally broken and fundamentally dangerous because it's in thrall to this disgraced former demagogue, Donald Trump, then the burden is that much higher on the governing Democrats to show the American people that there is another way.
You know, Jonathan, as I am panting my way through the end of this book in bed over the weekend, I read a quote from Malcolm Turnbull, former Prime Minister of Australia, who described as moderate conservative when he's talking to you guys. Here it is. You know that great line that you hear all the time, this is not us, this is not America? You know what? It is, actually. And right after I read that, I went online and I saw an interview you two did on the CBS Morning News, and you said something, Jonathan, like, well, the optimistic take on this is voters control their destiny, but I would argue they don't control their destiny. Campaign finance laws, voter suppression laws, a Supreme Court that doesn't give a damn, where the American people are overwhelmingly on issue after issue, like abortion, for example. So how do the voters in America in 2022 and beyond control their destiny?
I mean, I would refer you to Donald Trump, who lost the presidency and lost both chambers of Congress. We get this question a lot from people talking about the book, which is, when is Donald Trump going to face accountability? Look, from a legal realm, I can't litigate that. I don't know what's going to happen to him judicially. But like, clearly Donald Trump and the Republican Party paid a pretty severe price for the last 4 years. They lost the presidency in both chambers of Congress almost entirely as a rebuke of Donald Trump himself. So I think there has been some accountability. But look, are there structural challenges for Democrats in this country, particularly given their inability to win a lot of the rural voters who 15 years ago they were winning comfortably? There absolutely are. But I think clearly Democrats have an opportunity to take advantage of the wide disdain for Donald Trump in America. But as Alex mentioned a minute ago, they have not yet figured out a way to do so in a coherent way. In part, yes, because of their tight majorities, but also in part because their coalition is so ungainly right now. And I think Biden has never taken a side between the kind of moderate anti-Trump wing that just wants to sort of try to make incremental progress, in the more progressive ideological wing of his party, which wants to remake the country. Biden never put in with either camp, and he's paying the price today.
I only have 30 seconds left, Alex. Speaking of voters having their say, the Republican Party is on the other side of voters on climate change, on abortion, on gun safety measures. Yet if the polls are right, and we don't know what's going to happen in the next few months, they're about to return Congress, the Republican Party, to power in Congress quickly. Can you explain that?
I mean, it really is an unfortunately simple reality that we have a binary political system. We're not as dynamic as other countries. If you don't like the way things are going with the party in power, you only have one alternative, and people often pull the other lever without looking too closely at the policies that are involved. And Jim, you know what happens after that? Then people start to register what the policies are involved, and they go back to the same binary choice in 2024. And if it ever feels to people like we don't get a whole lot, we don't get very far down the road in this country, we just keep on veering back between right and left, well, there's a structural reason for that.
Alex Burns, Jonathan Martin, as I said, terrific and terrifying all at once. Thanks. I really enjoyed it. Good to see you both.
Well, there's an endorsement. Thanks, Jim. Appreciate it.
The book again is This Will Not Pass: Trump, Biden, and the Battle for America's Future. That's it for tonight. Please come back tomorrow for Talking Politics. For now, thank you for watching, and please don't forget Ukraine.